Hey guys, it's Dr. Josh, and today and this week I'm going to show you what I do for protocol to help knee pain. Now, a lot of people out there ask me on YouTube and all these other questions within my office, what can I do if I hurt my knee? Particularly in Jiu-Jitsu, if you popped your knee, you know what it feels like. It could feel a little intimidating. You can have some tenderness. You may think you have an ACL, MCL, or some sort of issue. But we want to make sure that we are reducing the pain right away. So I actually just popped my knee maybe about a half hour to 45 minutes ago on the outer aspect here, so the LCL. There was no accompanied pain, but when I went into this type of positioning, I ended up feeling some increase in discomfort and some pain, so I just stopped. Now, I'm still not having any pain, but I do feel a little bit of discomfort onto the lateral knee. And so the chances of somebody like yourself out there, if you're watching this, if you just hurt your knee, maybe it's not painful, maybe you can go back right away, but the pain and the inflammation might actually start to set in. So what I'm trying to do is get ahead of the game to reduce the amount of discomfort and pain and inflammation and start the tissue reprocessing or rehealing so that I can get back as fast as possible. Worst comes to worst, it is more of an injury and I need to have more time off the mat or off my activity. And likewise for you, it may actually require you to actually seek care. There is a high correlation for those people who seek care and get treatment right away. So I would urge you guys to get care right away. But in this episode, I'm going to explain a few things that I would do on day one of hurting your knee. First things first, make sure that you really seek care if needed, right? I mean, I have advanced knowledge. I have people here that can look at me, but at the end of the day, it's really about providing care and making sure that I have no future problems into my knee. Now, after that, I'm going to use some laser therapy that we can see right here. That's going to help reduce the inflammation, soft tissue healing. I am going to apply ice anywhere between 3 and 5 times. I do have a full work day. You probably have a full work day and you probably have things to do, but I am going to apply some ice and I am also going to rock tape it in order to make it happen. So what we'll do is we'll set ourselves up, for our laser therapy, and then we'll go from there, okay? So let's show you what the laser is. So the first thing we're going to do to help this initial injury, to make sure we reduce the pain, improve the healing, add some blood flow, is to use this laser. So I have everything all set up. I'm going to place my glasses on so that this way I do not hurt my eyes, because this can be giving some issues there. So this is ready. I'm going to just show it on this side here if I can. And so what we do is we just have this red light laser coming on here, and we're going to do it all over the lateral aspect of our knee, slowly moving it around, making sure we cover the injured area, maybe a little bit above, a little bit below. Get some of that hamstring tendon back here. And so this is going to be really good for some soft tissue healing and to get the process started. I am probably going to be doing this twice in a day. For today, I'll probably do one in the morning, maybe one in the afternoon, or maybe one in the evening before I go home, and really try to get this down. So the thing is, you have to keep moving this laser. That's really about it. You do have to keep moving it because it does emit some type of heat and stuff like that. So you want to make sure that as a result of that, you don't burn somebody by just holding it in place. So we're going to go right across the back. So, a lot of people think that you need to go to doctor offices in order to get this done. There are centers out there, there are places out there that you can do to get this type of treatment very quickly if you're interested in it. So at our facility, we obviously have it, but what we're going to do in addition to this, I'm going to apply some kinesio tape and rock tape. And a lot of people will say, well, why are you applying rock tape? Well, I got to be on my feet the whole day. I got to see a few patients. I got to be active. So to help reduce strain on the lateral MCL, or LCL I should say, and being on my feet, I just want to make sure that we don't injure this any further. So what we'll do is, this is going to go on for another 3 minutes, and then what I'll do is after this session is over, I will come back and recap you with my next few protocols. So now that our laser therapy is done, my knee is all completed here. The next thing I'm going to do, since I do have a busy day at work, is I'm going to just tape the LCL with a good amount of stretch. So I've showed this in the past, but what I did is I just cut a strip of tape here, and I'm going to apply about a 75% stretch over the LCL going this direction. I'm going to keep a little lock in here. I'm going to keep a nice stretch over the LCL, right over that pain area, just like this. So we rip it off in the middle. These anchors or ends or tails here do not get stretched, and we just kind of place it down here. And then what we're going to need to do is the same thing on the top. So now I have a little bit of protection onto the back of the knee. I typically do not like to go this way because I don't like to get behind the knee, because the knee can get a little bit of sweat and wet and cause a little irritation to the back of the knee, and then it's hard to tape it. So I like to tape in this linear fashion. This is not going to help protect you from, further injury or anything like that, but it may take a little strain off of it if you have to be on your feet all day. Maybe if you have a seated job, not a big deal. I would highly avoid you guys trying to stretch it and kind of do these types of lateral movements and just try to keep it more linear, like a hinge today on your first day if you did hurt it. So that is going to be my thought process. And then right now I do have about 10 minutes before my first meeting, so I will probably ice for about 5 to 10 minutes, and then I will start the day. So those are going to be my protocols for the rest of the day. Like I said, I'm going to be lasering one more time, maybe 2 more times. I will be icing about 3 or 4 times throughout the day, and then I will pretty much just stay off of it and not really contract it much, and kind of give it some time, maybe go for a nice little walk gently. And that's about it for today. So in terms of exercise or therapy, don't try to stretch this. Right now, it's probably going to get more sore tomorrow and the next day if you're something new, but I will report back on a daily so that you can see the protocol path and what you can do if you did hurt this, okay? Hey guys, I'm here with TJ, one of my coworkers, and today, as I told you, I hurt my LCL, and so on day 1 I told you I'm doing a lot of treatments. One of the treatments I'm doing is acupuncture, so he's gonna help me out and beat me up a little bit. So this is obviously safe to do, right?
Yep, absolutely.
Even in the acute setting.
Yep.
So what are we gonna be doing today?
The more acute, the better. You can get a good handle on it. We're gonna work along these fascia lines, all the things that attach here to the structure. This also happens to be a channel of acupuncture, the Shaoyang channel.
So you said something about like a lateral line or something?
Yeah, so it's basically a lateral fascial line, the spaces between all the way down through the foot, and then actually it jumps to the next channel, which goes up the other side. You can think of these as like agonists or antagonists, kind of very similar. So
a lot of people...
Something to put under your knee to keep that... You know what, this'll work.
Baseball bat. Perfect. Yeah.
Just to give you a little round there and let you relax into it.
So a lot of people ask, does acupuncture hurt?
Yeah, usually what I communicate to people is that initially, this is like a sharp hair. Initially, it's going to go into your skin. Your skin's going to tell you that something sharp is being poked into you. You might want to check it out if you hadn't already authorized this.
Yeah.
But after that will give way to a sort of dull, achy, heavy sensation. That's the therapeutic sensation of acupuncture. That's the part that's actually helping you. Mm-hmm. We're creating a conversation between your immune system and the area where the needle goes in.
Got it.
Okay? So we're actually going to start here on this opposite channel. We're kind of like opening the other end of the pipe here.
So if somebody's like scared of needles, or what do you do with that?
I mean, you try to just kind of keep their mind off of it, but to a large extent, it's really about...
It's a little tender there.
Yeah, I know. I imagined it would be. That's why I'm going there. Basically, when someone has a fear of needles, it's best just not to look. But ultimately, there is a sort of intellectual override. It's a level of a little bit of endurance, because I would say the dull, achy, heavy sensation is discomfort rather than pain, if that makes any sense.
I know what you're saying. Ooh, that one felt a little...
Spicy, huh?
Yeah.
That is the command point of the sinews and tendons. So it would make sense that here, are you tender in there now?
Yeah. I think a little posteriorly, a little bit.
A little posteriorly, okay.
If you,
There are actually 2 points. There's one there and one there.
about the same. I think maybe the first one that you just did.
Okay, yeah.
Either way, I'm sure you can't go wrong with that.
No, you can't actually. That actually is interesting.
Just some of that dull.
Yeah.
Over there.
Yeah, that's
Mostly.
good. It's good. We like that. And coming down here is just sort of the distal part of the channel. The most powerful acupuncture points are believed to be from here to here, and from.
So how many needles do you need? Is there more better? Is less better? Is it just what you think is going to be? Is it dependent on you? Is it dependent on me?
There's no set limit, but there is a possibility of too much. Of course, I would love to be able to put 2 needles in and be like, you're good.
Oh, of course.
But in this case, we're just kind of trying to focus the body specifically on this area and the stress that was put on your knee. So I'm going to focus pretty much on 3 channels, this partner channel that runs into each other, and then something along here probably, which is tibialis anterior, but are also
tender.
Yeah, they're also
there.
Yeah, and they're also acupuncture points. So some of these are all acupuncture points on channels that were mapped thousands of years ago. This one also happens to be peroneus brevis, the motor point of peroneus brevis. So
Just pretty important for foot stability.
Yeah.
For those people who are maybe new to anatomy. Nice. So how long do most people keep needles in? Do you take them out in a certain order?
15 minutes is like a good dosage, set dosage. Sometimes we'll leave them in longer. Say if a muscle spasm was the issue, we could leave them in up to 25 or 30 minutes. 15 minutes is usually like a good rule of thumb.
Cool.
In terms of taking them out, oftentimes in this case, I want to encourage movement along this fascial line and then back up this fascial line.
So you're kind of working outside.
Yeah, I would go this way. But when I needled first, I wanted to activate this first, kind of like I said, opening up the other end of the pipe before I started coming down here.
Got it.
So there's a little bit of method to the madness here. Are you tender in here at all?
Surprisingly not.
Okay.
I feel that ache on the outside of this area.
Yeah, that's what we
There's
kind
this
of
like
want.
line,
Yeah.
if there's such a thing.
Yeah, there is. This is the channel.
That's exactly where I go.
Okay, good.
Some...
Nothing under the kneecap, right? No.
No, I feel like when I walk, there's a little pressure here. But again, for those people watching, and this has happened about 4 or 5 hours ago.
That one. Yeah, it's a little spicy, isn't it?
Yeah. Ow. All right. Deflate the balloon in there.
A little bit, yeah. These are good ones for knee pain.
Ooh. All right. She is flowing.
You ready to tap out now?
Maybe in 5 minutes.
Okay. So I do want to do one more. So this is kind of one of the cool things is that all of the measurements in acupuncture are in the scale of the person. So this for instance is 16 sun or body inches. So your 16 sun is different from mine.
Of course.
So on me, if I got to measure me, I can take 3 sun and do this. But if I want to measure you, I got to take yours. So I'll put that. Oh wow, you got a whole finger breadth. So if I'm going to measure 3 on you, I got to make sure to do
I
that.
got thicker, fatter hands.
Yeah, stronger hands. It's all in jiu-jitsu.
Look at where it rendered me.
I know.
No. So I know what I'm noticing as a practitioner. I'm trying not to be too much of a practitioner now.
Yeah.
Everything's on slightly different angles. Like instead of it just going 100% 90 degrees perpendicular.
Right.
I see this one's at like 30 degrees. This one's at almost straight in.
Yep.
This one's
Yep.
This one's at a huge angle.
This one's at a huge angle because we're going up under the patella. This one is, again, down, kind of towards as if it is going under.
So what I feel is like this little.
Yeah.
I feel like this path.
Yeah. So a lot of times perpendicular is perpendicular to skin. So
Yes.
if you actually
So
look at
it
it
would be
from
like
this
here.
angle, this actually is perpendicular to the area that it's on. You see what I mean?
Yes.
Um,
And so I think you said something to me that was really cool a long time ago. Like the purpose of acupuncture is to kind of have that foreign, sterile
right.
thing. So can you explain that?
Yeah, sure. So one of the many functions of why acupuncture works is that we're putting a sterile foreign invader in the body. The alarm system goes off, right? The skin
Immune
goes,
system.
what's that? No, first the alarm system, because it's like, what is that? Something's going into my body. That's the sharp, right? The dull, achy, heavy.
Which is this one right now.
Right. So all of a sudden the brain is going, okay, what is that? And
Now
so
this one. Look at this one pulsing.
yeah, that one is doing some stuff.
It's like a bee.
Yeah, the new capillaries form to go see what that foreign invader is. It sends white blood cells, T3 cells, T4 helper cells. They're all undifferentiated white blood cells, immune cells, natural antihistamines, etc. They get there and they look at the needle, and it's a sterile needle. So there's nothing to fight. Now these cells aren't higher intelligence, so what do they do next? They're here to do something. They look around and say, oh wow, that tissue looks a little frayed, or that needs to be building right there. So we're focusing the body's healing.
So even if someone is healthy, no injury, there could be an application for it.
Yeah, absolutely.
However, most people don't find us for health. They
That's
find
true.
it for pain or
They find us
something.
afterwards, yeah. All right.
Cool. And so I just kind of marinate here.
Yeah,
and
you just
hang
cook
out
for a
and-
little bit.
Cool. Well, thank you.
You're welcome.
See you and you don't advise us taking this out.
No, definitely not. I will be back to take your meals
Yeah.
out.
So I will try to lay down and I can move my leg a little bit.
I would try not to move
Okay.
super much.
So I'll just put my other leg up here.
Yeah.
There you go. And I'll just talk to the audience by myself.
Okay.
Cool.
Cool, man.
Thank you.
I'll be back.
See you in a little bit. All right. So, pretty unique. I haven't gotten acupuncture in a while, especially for this injury, obviously, since it is new. I do feel a lot of achiness going on here, here, and here. So, like this little triangle path. So there's 1, 2, 3, 4, 5, 6, 7, 8, 9 needles in here, and we're gonna hang out for a little bit. Some other things I did not mention when it comes to our treatment protocol or what I'm planning on doing is nutritionally. I'm going to increase my supplementation, and I'm probably gonna have at least collagen every day, if not twice a day. I like to be a little bit more, I guess you could say, overzealous and say I'll do it twice a day, but the reality is I'm probably only going to do it once a day. But I am probably going to end up doing that today while I'm at work, increasing my supplementation, because when the fridge is empty, so to speak, when you have no food in there or not the right nutrients and you're trying to heal, it's really hard to go home and then be hungry and then have to go back out. But if you're hungry and you come home and all the nutrients are in the fridge or all the food's there, it's just a lot easier to heal. And so nutritionally, for connective tissue healing, soft tissue healing, I am going to add some collagen and stuff like that. So I will also ask our acupuncturist what he would recommend for me to do to help healing, because I think that'll be a common thread and common question that you guys probably have is what can they do, what can you do outside of exercise or fitness that you would do to help yourself. Keep in mind also, guys, a lot of people will ask, I am on my own chiropractic table in my own office. There is somebody in his room. So I may be laying down or face up. I might be in a more comfortable position. In this case, I'm here. Come on in.
feel like I'm coming into Mr. Jagoda's neighborhood.
Yeah. So I was just saying, a lot of people will ask, after the session's over, whether it's 5 minutes, 25 minutes, well, that was nice. 30 minutes, whatever it is. What would people do on their own? What would you recommend people do on their own?
Well, there's no.
Now, obviously, this is like a little knee sprain. So,
Right.
What would you recommend for somebody to do? I obviously I can't needle myself, nor would you recommend that.
Right.
Especially if you're not certified or have your license in it.
Yeah, I would encourage people to kind of to roll out their IT band in this case and roll out from the tibial head down to the ankle, just kind of promoting blood flow through here, and try to loosen all the muscles and connective tissue that connect to this area.
But not directly on the acute injury.
But not directly on the acute.
That's exact advice I'd give is, and I said before, don't stretch this. You don't want to create torque on a lateral meniscus or LCL or MCL that just got hurt. Let it stabilize itself.
Right.
Work everything around it. Don't work this. And if you noticed, my thought process today is keep everything very linear.
Mm-hmm.
And I'm not even going to exercise today. I'm actually going to hop in the infrared sauna after this.
Right. Yeah, and I agree with that. And there are no contraindications, broadly speaking, about exercising after acupuncture.
A lot of people want to do this.
Right.
But in terms of not what we want.
But in terms of injuries, of course, this is a place where you want to rest and recover.
I do feel good, like achy dullness through this like upper portion, like here,
good.
Here and
yeah,
here.
That's what we want to focus
and here.
Yeah, and
a little
also
bit here.
Yeah, and also good to work this, whatever the opposing side is as well, with a little massage or tennis ball, lacrosse ball, or anything.
All these things over here.
Yeah, or
Cool.
a gun.
Thank you, man.
You're welcome, man.
Happy healing.
Yeah, you too.
All right, guys. So now that session is over, I'm gonna hop into. Okay, guys. So now that session is over, I'm gonna hop right into our infrared sauna. I've had that kind of brewing and heating up. I'll probably hop in there for about 20 minutes. Reduce inflammation. Probably start sweating a little bit. So before I do that, I'm gonna chug a bunch of water. Hop into the infrared sauna. Probably after that, then I'm gonna drink my collagen. Eat some food, get the day started, and go from there. So these are my protocols that I'm doing for this entire treatment for day 1. And so we'll see how I feel on day 2. But I assume I'm going to be sore because I'm starting to feel some increased pressure as the day goes on. I did find that even though you saw this earlier, I did tape it. I found that, when I took off the tape to help us do acupuncture, I actually found that the tape actually felt better when it was removed. So I actually am not going to put the tape back on right now. But let's hop in the infrared sauna that's heating up, and I'll show you what that looks like. All right, guys. So here is our infrared sauna. It is only up to 128 right now, but this is what it is. We're going to hop right into here, and we'll go in there. So I'm just going to increase the time, and of course the temperature will go up as well. So this is what it looks like. Small little infrared sauna, but I'm going to make sure that everything is up. Reset the timer. I'll stay in here for about 20 minutes, and this is what it looks like. So view from inside our sauna here. 2-person sauna, but I'll stay here for 20 minutes.